privileged to something very special. As you know, I've been talking about this for years because unfortunately for years I've been plagued with shoulder pain, bad arthritis. From years I like to think of heavy bench pressing and shoulder pressing, 315 behind the neck, bench pressing 405 on the incline. And you know what happens? The joints wear away. And you know what? Progressively it's gotten worse and worse, and people have told me, doctors have told me, go get shoulder replacement, you'll feel so much better. And I've talked to people who've had it done, and some people said it was good, some people said not. And I said, you know what, I'm gonna wait, because the longer I can wait, the better the technology will be, and there'll possibly be some kind of alternative therapy. And I know people always say, it's a pipe dream. But you know what? That therapy might be here today. I've talked about it before, stem cell treatment. Stem cells are undifferentiated cells that they can isolate from the body, and they can put into an area, and they will then differentiate into that tissue. In other words, stem cells can turn into new cartilage cells and create new cartilage lining my joint of my shoulder capsule here, the head of the humerus, the capsule, give me more lubrication. I'm going to a doctor right now. If you look over there, this is the entrance. My good friend Derlin Castro, this is his office. And as you can see, Dr. Eric Siegel, orthopedic surgeon to the stars, as I like to say, works here at Derlin's office. He's been doing PRP therapy on people, for prolotherapy on people. He just started doing stem cells a couple years ago, and he said he's been getting great results. I talked to him on the phone yesterday. He had to have these stem cells flown in, overnighted here. They come from a very reputable lab. They clean the cells. They're undifferentiated cells, so you can put them into your body and you won't reject them because they don't have any immune markers on them. And hopefully, in my body, they will turn into cartilage and start growing new cartilage in there. As a follow-up, every 2 weeks, I'm going to go back for the next 4 weeks and get PRP therapy. That's platelet-enriched plasma, which is going to help with the growth factors and help those stem cells, nourish them and help them to grow better. And then he's going to finish off with some prolotherapy, which is also a good nourishing type of solution that they put into your shoulders. So I'm set up for about 4 shots. Today will be the first set of shots with the stem cells, and I'll find out if I can actually heal myself. And I know you guys out there, there's a lot of guys out there with joint problems, and you're saying, man, if Palumbo can heal himself, then anyone can. It also comes up here. You gotta have a strong mindset. You gotta believe that it will work so that your mind and the energy here will heal yourself. And that's what it's all about. So I'm gonna go in there today, and I'm gonna have an open mind, and hopefully when I come out and 6, 8, 10 weeks later, I'm gonna start to be able to move. Now my range of motion right now this is about as high as I can go without serious pain. I can get it over my head a little bit more, but as you can tell, I'm kind of contorting my body. It hurts a lot. There's a lot of pain. Overhead, I have really very little range of motion and pain in here. If I can get back some range of motion and the lack of pain, get rid of some of that pain, that would be great. Now, as you know, I still train in the gym because I don't care about the pain, but it would be great if I could work out and not be in so much pain. So let's go inside. Let's see what Doc Siegel has to say, and hopefully we're gonna get some great treatment. All right, we're in the office now with Dr. Siegel, and we're gonna talk to him a little bit about what's going to be going on. Explain the procedure here, because a lot of people don't understand exactly what stem cells are, what they do, and what they're going to be able to, I guess, help me with.
Okay, basically stem cells are a pluripotential cell that can pretty much make any type of cell in the body, the way it's prepared. Such as a baby's born, people talk about fetal cells. The actual cell will take on the same characteristics of where it's actually placed. Such as in your case, since we're putting it into the shoulder and into the cartilage, it'll actually regenerate and rejuvenate the cartilage.
How does it know to turn into cartilage?
It's a great question. Basically, what'll happen is when we put the stem cell within that region, it's almost like a skeleton. It'll go ahead and take the blood supply and all the characteristics of the surrounding cells and actually build the same type of matrix of the surrounding cells themselves.
It's amazing. It's amazing. And how long does something like that happen to take? Like, what's the process of the stem cells turning into cartilage and actually layering the bone?
From actual implantation to, let's say, feeling well, probably about 2 to 3 months, but for it to totally regenerate, on the average of about 6 months.
Okay, so it's a 6 month process.
Probably about 6 month process.
Now, what's the obviously I'm an active guy, I work out. What's the recommended off time to take, and will the cells continue to grow even when you're working out?
Oh, most definitely. Off time, I'd like to take a patient, especially somebody as active as yourself, probably about a good 6 weeks of, especially since you're lifting heavy,
I'm not
things of that
lifting so
nature.
heavy anymore.
So, because the show, no, understandable. So this way, it won't irritate or aggravate the cells as they go ahead
Yeah,
and
you don't want to obviously
implant it.
grind on the cells
Exactly.
as they're trying to form.
Exactly.
So it's 6 weeks of no weight training on the
Yeah,
upper body?
for no weight training. Your stretching would be okay, things of that nature, because we wouldn't want you having a frozen shoulder
Right.
or anything of that nature. But nothing so intense where, like you said, it's going to start to grind down the new cells that are actually being implanted and trying to embed themselves in the existing tissue.
What about just movement?
Movement's okay.
Stretching?
Yeah, stretching's okay.
Is that okay?
Stretching should be.
All right, so
fairly well.
what's the procedure? Before we get, I know you're going to use an ultrasound machine here to guide.
Correct. Yeah, we basically use ultrasound where we'll be able to look at the joint. We'll be able to look at the musculature. We'll be able to look at the bone. This specific machine is equipped also with a specialized needle procedure technique where we can actually watch the needle go into the joint, so we know
Wow.
exactly where we're going to be placing the stem cells.
And what's the pain aspect of the injection? Does it hurt at all?
It shouldn't. We'll go ahead and use just a surface anesthetic, so this way you won't feel anything.
Okay.
You might be a little sore, but that's pretty much all it is. Maybe a little bit of soreness.
For how long usually? How many days?
On the average, probably about 72 hours.
All right,
Yeah.
so that's not bad.
Right, and we
I
try
can
to
handle that for some shoulder movement.
Yeah, we try to stay away from any types of anti-inflammatories because in a way we do want some sort of inflammatory reaction for it to adhere the existing bone to the new bone as well.
Gotcha. All right. Well, let's see what happens. I guess you walk us through it.
Okay.
How do you want me to lay down?
So
here?
let's see. So let's go ahead and do the right shoulder
shoulder,
first.
yeah.
So let's get you on your left side. And let's get you all set.
All the crazy things I do. You guys, just for you guys. You guys can see me,
There we go.
healing, growing, whatever the case may be.
So we'll expose the shoulder and we'll get our markings. So first we're going to mark the acromioclavicular joint.
I've had in the past some Synvisc injections about 5 or 6, maybe 8 years ago.
Okay.
And so I guess the procedure is the same thing, a long needle into the joint.
That's correct, right into the glenohumeral joint. And we'll just get our landmarks. This is the inferior portion. Here's the medial deltoid.
Luckily with no body fat, I have my landmarks are a little more.
They're much more pronounced.
Yeah.
No doubt about it. And I want to get that infraspinatus right there. So you can take that on the humeral joint.
Now, is it harder in someone who has arthritis to get into the
It is.
capsule?
It most definitely is, and that's one reason why these always should be ultrasound guided. For that reason, this way it cuts down on any possibility of hitting any bony structures.
Or just missing the joint.
Exactly. So looking pretty good. Excellent. And what I want to do is just double check and make sure everything's firing properly. So what you can see here is the anterior deltoid, medial deltoid. You have the recess right here. So our spots are in good shape. And we're going to enter right in through here, through this lateral portal. So a lot of times when we do arthroscopic surgery, we'll have the 3 portals, an anterior, a lateral, and a posterior portal to get into, take a look at the actual joint itself. So pretty much we'll mark those areas.
Now,
And those are marked well.
Does the stem cells, will they kind of like permeate the area themselves?
Oh, most definitely. What we will do is we'll put them into the areas where you have the chondral defect or where the cartilage is causing all the problems.
Which is the whole joint, basically.
Which is the whole joint. So it'll basically start to almost like cause a film around the entire joint itself.
Now, is there anything else inside this except the stem cells
No.
you're putting in today?
It's just stem cells. And here are our stem cells. We'll open them up, which we ordered. And we'll get these opened. And we'll get these recorded. And they all come prepackaged for one patient. And this is approximately 1 cc of stem cells. So you can see it's a very clear solution. And these are all the cells that are going to regenerate the entire cartilage within that joint. And
what are the various joints that you've actually done this on?
Oh,
or you can do it on?
I've done Achilles tendons, I've done knees, shoulders, actually a few boxers we actually had to do their fingers because of the chronic pain and discomfort that they've experienced over those areas.
So for like arthritis in the hands?
For arthritis in the hands,
Wow.
it works wonders.
What about like neck or spinal stuff?
Neck and spinal stuff, I'll use more PRP. I found out to probably do a little bit better. And we'll also follow up with PRP with this to go ahead and give some more glide to the shoulder joint itself. And I basically equate the PRP to almost like that wonderful substance called Rain-X that you put on your windshield, where when it rains, the water just beads up and just keeps the friction down off of the entire area.
The PRP, though, what does that nourish the stem cells?
That will nourish the stem cells. And the nice part about that is that's your own blood that we clean and then we just put back within that area. And we go ahead and wash the PRP, and the only thing that we're using, and PRP basically is protein-rich plasma. And when we clean it, we have between 600 to 800% more healing properties to the joint itself or to the torn tissue. And it works wonders. And again, we could do it pretty much to any type of musculoskeletal injuries, some bony injuries such as to the knees, a condition called chondromalacia patella, where it works wonders. And now we'll go ahead and titrate up our stem cells. So I like to use a 3 ml syringe since we're only using 1 ml of actual content of the PRP. Again, we want to use a large enough needle not to damage any of the actual cells. So drawing up the stem cells, I'll use an 18 gauge needle.
You'd think it would come in a preloaded syringe already.
Yeah, well, there are so many different types. A lot of people can use, a quarter or a half of ml. So right now we're using 1 full ml. So we make sure that there's nice and clear, and everything that is nice and clear, we'll titrate it all up. I'm going to use all of it. And we are all loaded up, which is perfect. Make sure we're not missing anything. So we got 1 full ml. We go ahead and make sure we don't have any bubbles, that we can use all that we need. Because again, we don't want to introduce any bubbles into the area. That's
now,
good.
Dr. Siegel, I think we should address also a lot of people, some doctors actually harvest these stem cells from a person's iliac crest, or they get them from their fat cells. What's the difference between the stem cells we're using that come from a lab as opposed to the ones that you would get from like a person's body?
These are a little bit easier per se, because if you have to harvest it from the patient's iliac crest, they have to be sent down to the lab to be washed, cleaned, and taken down all the way down to the actual fluid that's utilized for this type of procedure. So it's a much longer, painstaking process as compared to, let's say, ordering it from a lab that's already cleaned and washed and has already prepared the actual solution itself. And what we're going to do...
Is there any difference in potency?
None whatsoever. That's the nice part. They're all pretty pluripotential cells and multipotential cells, so they do pretty well. And I'm just going to go ahead.
And a lot of people ask, why wouldn't you reject like someone else's stem cells?
What'll happen is you don't know again what somebody else's immune system is doing. So a lot of times you're not going to go ahead and utilize somebody else's cells per se, unless it's cleaned, washed, and ordered from a. It's very, very important. Yeah, so it should always be from a certified lab. So I'm just going to do just a little subcutaneous anesthetic. This way you don't feel any pain whatsoever when we put the injection through. We're just going to get these 2 spots.
For me, this is a joke.
There we go. You're doing great. Okay. So what I'm going to do is I'm just going to go ahead and wash the area once more. We're going to go ahead and clean our transducer head. And we're going to go ahead and find our landmarks.
What kind of needle do you put in there? Like, what's the gauge? How long is it?
Basically, what we're going to be utilizing is a minimum for something of this nature. You want a 25 gauge needle of approximately 1 inch, or it can be longer depending on how far that we actually have to get into the joint itself.
Do you usually
so
use
we
a
can
longer
see.
Needle just to play it safe?
Oh, definitely, if necessary. Yeah, something like this. When I look at your skin, as we can see, here's the cartilage. We can see the irregularity of the cartilage. Okay, so this is all the white in through here, but we can see how it's very, very irregular. It should be nice and contoured. So what I'm going to do is take a picture. So I'm going to put it right.
This is like the before and after pictures of the fat person and the skinny person, right?
You have it. Glenohumeral joint. So this way we can always have a comparison. So if we ever need to redo this again for any reason, we always can see what's going on. And we can see the spacing is very, very close. This black is that interface, which is the actual glenohumeral joint itself. So
let's say the cartilage goes back, you still, the joint space is never going to increase, will it?
The joint space probably won't increase, but we will go ahead and be able to at least give you some pain relief, right. As well as with the follow-up with the PRP to go ahead and allow the gliding. In this area, we can see a better interspace in through here, but we can still see the irregularity of the cartilage. See how it dips down? We have a little bit of a chondral defect right in through here. So what this whole procedure is going to be is to fill in that chondral defect.
Will it fill in?
It will fill in.
The stem cells will fill in.
Most definitely. Yeah, it's actually going to grow. It's actually going to grow cartilage.
And will it grow in a smooth fashion?
It should grow in a smooth fashion.
Will it contour the irregularity?
It should basically contour in a nice round, smooth fashion, which in turn will give you a much better range of motion, and also give you a much better outcome, as well as decreased pain and discomfort. And again, just looking around the joint, see again, glenohumeral joint in through here.
It looks like the surface of Mars.
Exactly. There are a lot of craters. There's been a lot of...
the surface of the moon.
Being a champion as you are, you've put a lot of mileage on the shoulders. There's no doubt.
I'd like to get a little bit extra time on.
We're going to make sure. You have a long way to go. You're looking fantastic. Just inside, the joints are very irregular, as you can see. So again, another chondral lesion should be nice and smooth. So, and that's right exactly where we're going to be entering.
Perfect.
How do you feel?
How do I feel? I'm ready.
We're ready to go. So I have my 25 gauge needle on my 3 ml syringe, all loaded up with 1 ml.
That's it. So that 1 inch
1
will
cc,
get right in there.
we'll get right in there.
You'll be able to get right into the joint. That's amazing. Thought it would be longer.
For you, we won't need it because your fat is very, very, very low.
A little uncomfortable, but not bad.
And as you'll see it, As you can see, the top right is starting to fill.
It's amazing to get into my joint with that one little 1-inch syringe.
Yeah, the good part is you're do not have that much fat here, which is good.
I don't think I have enough fat. I don't have any fat on my body.
That's for sure.
That's why I was worried. You know, the other people had said to me, "Oh, they got to get the stem cells from your fat." I'm like, "Well, what if you have no fat? You got no stem cells." This is good.
We are nice and complete.
Oh, that was simple, easy peasy.
And I know this is everything in through here. This is actually where all of it is. So now what we're going to do, I'm going to want to take this away.
It's a little uncomfortable. I'll say it's throbbing a little bit. It's a little sore right now.
So what are his limitations at this point?
So limitations, I'm going to put him in an arm sling for the next couple of days just to take some of the pressure. So I'm going to bring the shoulder up this way to take some of the pressure off the cartilage to allow the stem cells to just do its job, just to contour its way around the entire shoulder. And hopefully by Monday, I'm going to have you just to start to, just move it around a little bit.
I got to wear this
Just
sling for till Monday?
Just wear it for, during the daytime. Yeah, if you can, just to try to keep some of the pressure off.
I don't do well with slings for some reason. I don't know. Slings an hour is of outrageous fortune, as Shakespeare said.
And we are done. And that's pretty much it. All we need to do is just go through that lateral porthole. We didn't even need the anterior portal because we were able to get directly into right where the chondral lesions were. Amazing. So we did really, really well. Okay. And now what I wanted to do is just nice and easy. Just move it around. See how it feels. And what I want to do is just try to take the stem cells and just try to push it all the way around the glenohumeral joint and do an entire range of motion as best as we can. We'll do some external rotation. We'll do some full extension. We'll do full abduction. And we're going to get you to that 180. There we go. Doing great. And we'll do some abduction like that. And that's what we want to do, is just try to take those stem cells and just move them around that glenohumeral joint and let them set in on the existing cartilage that's damaged.
All for you guys. It's actually for me. It's a very selfish endeavor, actually, to be honest with you.
You did wonderful.
We'll see. We'll see what happens. Now we got to wait 2 weeks, right? We come back for PRP therapy.
2 weeks for PRP.
Is the PRP more or less painful than this?
Probably less painful.
Okay. And this didn't hurt. I don't know if it's gonna be sore. It actually feels better now. It's kind of like.
Yeah, you're gonna feel probably just a little throbbing, because that's actually the reaction of your natural immune system in your own body, just reacting to the cells themselves.
Is there any chance that my immune system might reject the cells?
These, none whatsoever.
Really?
No, I've never read any papers where you actually had any rejection because of the way the stem cells are cleaned and the way they're washed and the way they're actually prepared for usage. Such
it almost seems like this is a way better option because the cells are cleaned, like you said. You don't have to worry about it. They don't have to be harvested,
Most
which is probably the most painful part of the whole procedure, right? Drilling into your
ileum, and then the time consumed just trying to clean your own tissue for the implantation into the shoulder.
No time at all. This took, 15 minutes maybe?
Exactly.
This is great.
Exactly.
And I'm sure the PRP is a little more time consuming because you got to spin the blood down.
Correct.
How long does that take? 30 minutes?
Probably about, on the average, it takes about 14 minutes to actually spin the blood down through a specialized unit that we have that will clean the blood, and we just basically try to get a minimum of 10 mLs of plasma. And again, it's the same procedure for the most part, how everything is prepared.
You're putting
and
10
then placed
mLs in there?
You try to do about 10 mLs in there.
That's a lot more liquid.
A lot more liquid in there. A lot more liquid. And then it's absorbed into the bone itself.
And so you do 2 PRP shots 2 weeks apart.
Correct.
And then is there a third shot, you said?
Most of the time, I've only needed 2. I've never needed 3 on any patient.
And that's the end of the procedure.
And that's pretty much it.
You just kind of heal after that.
Exactly. I think the minimum amount of improvement that we've gotten out of probably about 80 to 100 patients that we've done over the past probably about a year and a half, to almost 2 years. It's probably about 90% improvement.
Wow. I'll take it. I'll take it. Sign me up. Oh, I already signed up. This is great. Thank you so much.
The pleasure.